Healthcare is full of people trying to find things. In our busy, dynamic work environment, people and equipment are constantly moving around the work area. As a result, we know this can lead to work areas becoming cluttered, untidy, and even unsafe. Stock can be hard to find, or it could be out of date. When staff can't find the things they need, they end up keeping more than they need of something just in case. This is called hoarding or stashing. Sometimes not all staff in an area know about a stash, so they think an area has run out of something and order more, when actually there is plenty, just not where they were looking for it. Also, whilst the practice of hoarding or stashing may help one area to have what they need, it means other areas may not have enough and lead to big variation on how much stock each area has. This variation makes it hard for stores people to know how much stock they need to order, as they don't know how much is actually in the ward and unit areas. We tracked how staff spent their day, and we know that nurses spend around 10% of their shift doing non-productive activities, such as looking for things or waiting. Of that non-productive time, 70% of it was staff just looking for things. Over a day, this equates to up to 2.5 hours per nurse spent looking for things. Over a year, that really adds up. Similar results were found when this type of research was done in other overseas hospitals, so it's not just a problem at our hospital. Looking for things is not only frustrating and stressful for staff, but it can have a significant impact on patient care, as patients don't get the things they need when they need them. In order to improve the provision of care for our patients and create a less frustrating work environment for staff, the process called 5S has been implemented in a number of wards and units across the hospital. 5S is simply a system of 5 steps, all starting with the letter S. Sort, shine, set in order, standardise, and sustain. Before you get started, it's a good idea to take some photos of the area you plan to 5S. Also, review data on the usage of items for your cost centre over the past 6 months or so, to get a feel for which items and how much of them you are currently using. Look for patterns of use. Are there any seasonal variations to factor in? You may also want to ask staff what issues they are experiencing with stock by questionnaire or at staff meetings. You need to let your manager, store staff and other stakeholders know that you are planning a 5S event. Sort is about the process of understanding what is needed in a work area and what isn't. It is often helpful to make 3 piles: often used, sometimes used, and rarely used. You might need a quarantine area to keep some things if staff need time to decide whether to keep them or not. Find out ahead of time what stock stores will take back, or can be used elsewhere if you don't need it anymore. If unnecessary items are still in unopened boxes or bags, you may be able to return them to stores and ask for your cost centre to be reimbursed. If a work area is used by a lot of different staff groups, then it may be helpful to do a red tag exercise. This is where red tags are placed on items that are rarely used, or perhaps untidy or disorganised or in the wrong place. Any staff can put a red tag on something. These tags are left up for a while so that everyone can see which items may be removed. That way other staff have a chance to respond to the tag and stop it being removed if they believe the item is still used or needs to stay. Red tags can also allow staff to realise they are the only ones who are using a particular item, and maybe they could do what others are using instead. You are not allowed to red tag people, unfortunately. Once you have completed the sort step, the next step is shine. Shine is simply about cleaning the work environment, removing hazards, and preparing to set up the work area the way it needs to be. The next step is set in order. This step is about working up the work environment in a way that promotes the flow of work. It is often helpful to observe how people use the work area and identify the sequence of how the work is done. What are the tasks you do a lot of? Are all of the items you need to do those tasks stored together? When we track nurses, we noticed staff were leaving a patient bay up to 13 times to get the things they needed. The main items nurses left the bay for were then put in cupboards closest to the patient care area to cut down travel time. Where are your storage areas? Plan for your most frequently used items to be grouped together and, if possible, close to point of use. It is often helpful to think about which items are used for similar things. We call these product families. When organising items back into the area, think about what items are used the most and put these in easier to reach places, between the knee and shoulder height. Remember OC health and safety principles of not having items on top of shelves, or heavy items up too high or down too low. Having each shelf and compactus labelled enables you to develop an address book so it is easy to find exactly where things are. New or relieving staff often find the address book a terrific resource and time saver. They also don't have to interrupt other staff if they can find it themselves. The fourth step is standardise, which is about making areas with the same function look the same. Lots of staff move around to different areas of the hospital, so having things set up in a standard way with the same colours, labels and codes means that it should be easy to find things you need wherever you are in the hospital. Sustain is the final step of 5S, and it is about maintaining the work area. Ideally, 5 to 10 minutes a day should be all that's needed to keep the work area in its original condition. Some work areas allocate 5S tasks to staff at double staff time. Sustaining happens best when maintaining the work area is linked clearly to roles and responsibilities, and a manager checks at least occasionally that staff are maintaining the area in the agreed way. Since 2010, a hospital-wide program has been assisting staff to implement the 5S principles to each inpatient ward area. This process has attempted to standardise each part of the replenishment cycle, from using the item to provide patient care, through to replenishment of the item back on the shelf. Each of the steps needs to be done correctly for the whole ward replenishment process to work properly. Each step has roles and responsibilities linked to it. This is really important for sustainability and accountability. The first step is use of stock for patient care, because the goal is to make sure staff have what they need, when they need it, in an easy way to provide patient care. The next step is called pre-scan preparation, which is critical for ward staff to do so it is easy for the scanners to see what needs to be ordered. Remember, for impressed items, if it doesn't get scanned, it won't get ordered. The next 3 steps are scanning the barcode, which is when the scanner indicates which items and how much needs to be ordered, picking, which is done based on what is scanned and is available, and replenishing, which is putting the items back on the shelves in the wards. The last 3 steps are the responsibility of the store staff. We all need to do our part regularly and thoroughly for the replenishment cycle to work best. An example of how to do a step thoroughly is the step in the replenishment cycle called the pre-scan preparation process. This is where wards prepare their stores rooms ready for the scanner by removing empty boxes, ensuring barcodes are all there and in the right place. This is so that when the scanners come to scan the item, they can see more easily which items need to be scanned. If you need to decant stock to other areas of the ward, it's best to do this right before your next scan day. This works best when this pre-scan preparation is incorporated into standard work practices and is clearly allocated. We have also found setting up a ward replenishment visual control board to be extremely useful. The ward replenishment visual control board is set up based on 2 questions staff need to know to do their jobs. What do I need to do my job? And who do I need to tell so others can do their job? Ward staff need to know several things. Who is the ward's regular stores replenisher? and how to contact him or her, what day scan day is, and if the scan or replenishment has occurred. So there are buttons next to the scanning day. Green ones mean the step has occurred, and red ones mean it has not occurred yet. What stock is a shortage and not available in the hospital on their scanning day? There is a clip for the shortages list to be put up, so staff know where to find it. Which items were scanned? There is a spot on the water replenishment visual control board for the picking list to go. The water replenisher needs to know who to contact on the ward, which areas to scan, so there is a scan location map in the areas they need to go marked out on it. There is also a spot for ward and store staff to write notes to each other as needed.
Before 5S, we thought we were doing pretty well because we were a new unit, had moved across in the previous 2 years. But after 5S, we realised that things weren't in the logical place. There was quite a lot of opportunities where instances where we found that we were critically low on stock that nobody had seen beforehand. People spent a lot of time finding things, not putting things back where they should, so there wasn't a logical placement of all equipment. But it would probably be the critical stocking, that we either had too much of something that we never used before, or we didn't have enough of something that was critical to our core business.
Well, our ward's very dynamic. It has 4 different areas: antenatal, postnatal, gynecology and gynae-oncology. So there's just a lot of stock for each of the things. So as you add on, everything got put in different places. So there was no central area for any one thing. So staff did spend a lot of time trying to find things on the ward.
So what we did was we had staff involvement. We asked staff to go around and assess what they thought was important, what levels they thought we needed of stock. We talked to them about the process. Jane, you came down and gave in services to staff as well. So people were informed of the change that was coming. They were still a little bit unsure, but they had involvement, they had buy-in. And so when they saw those changes evolve because of their commitment and input, there was more acceptance of the process, I think. And yes, some people said, I'm not quite sure about that, but overall the flow has been very good.
The things that have worked the best for us, I think, is putting things into product families. So everything has their own area, they're in their own coloured boxes. Agency staff, relieving staff, no matter where they work in the hospital, they know the coloured boxes to go to, they know the area that it's in, so it's easy to find things. It's in one spot, and that's what we like the most about it. And if something new comes onto the ward, you know where it's to go, what colour box it's to go in. The visual control board is a bonus because we never knew when the storeman came, or he hadn't been, or because he comes on a Friday for us, so obviously at the end of the week it's a little bit hard because you always run out of things. So when he comes, he puts a dot on the board to say, I've scanned the things, so don't go rushing off to stores at 12 o'clock, I will be back, which is great. And then when he comes back, he leaves us the list of what's been picked, what we don't have in stock, so we can look at that list by Friday afternoon, and if there's any critical shortages for the weekend, we can source them from other wards just for the weekend.
It was a really seamless transition. We expected a lot more resistance to change, and there wasn't. I think because people could see how logical it was. It all made sense to them. We had fantastic signs and communication with the staff, so they embraced the 5Sing. They could see that we were less on stock. One of the key points was as well looking at where the pharmacy and the stores people had come along. So there was less time of writing out individual stock requests, phone calls. We were much more efficient with our time and far less peaks and troughs of stock levels. So it's been fantastic.
Ultimately, 5S is all about respect. All staff should be able to work in a safe and organised environment and find the things they need when they need them to deliver patient care.